Hi, I'm Dr. Joe Krepp, and I'm a cardiologist at Virginia Heart. Cardiac diagnostic testing is designed to give us valuable information about how your heart is functioning using non-invasive or minimally invasive methods. Each test answers a slightly different question, and together they help your cardiology team get the clearest picture possible so we can recommend the best care for you. Let's discuss stress testing. A stress test provides your healthcare team information about your heart's function while under stress from either physical exertion or a medication to simulate exercise. The most basic form of this test is a treadmill stress test, also called an exercise stress test. During this test, you'll be connected to ECG leads while a trained technician monitors your heart rhythm and blood pressure. You'll begin walking slowly on a treadmill, and the speed and incline will gradually increase while we watch closely for any abnormal heart rhythms or signs of reduced blood flow. And don't worry, everyone eventually reaches their exertional limits, and that is completely expected. A more advanced option is a nuclear stress test. This involves imaging your heart at rest and again after stress. After an IV is placed, a small amount of radioactive tracer is injected, and a camera takes images of your heart while you rest. Later, you will either exercise on a treadmill or receive medications that simulate exercise, followed by another set of images. By comparing the images at rest and after stress, we can get a sense of the blood flow to your heart muscle. The entire visit typically takes about 3 hours. The most advanced and comprehensive stress test that we offer is a cardiac PET-CT scan. After a small IV is placed, you'll undergo a non-contrast CT scan that includes a calcium score. You'll then receive a specialized radioactive tracer and a medication that simulates exercise. This test provides very detailed information about the blood flow to the heart muscle and is completed in a single visit, often about 30 minutes. One of the most commonly used tests is an echocardiogram, or echo. This is essentially a heart ultrasound. It usually takes about 30 minutes and uses sound waves to evaluate how strongly your heart is pumping, how your valves are working, and the pressures inside different chambers of the heart. A trained sonographer places an ultrasound probe on your chest to get images of your heart, and then a cardiologist will review the images. Another imaging test we frequently use is a cardiac calcium score. This is a specialized CT scan of your heart that does not require contrast or an IV, but it helps answer a simple but important question: is there plaque present in your arteries? If we need a more detailed look at your heart arteries, we may order a coronary CT angiogram or CTA. This test uses X-rays and contrast dye through an IV to create a detailed roadmap of your coronary arteries, allowing us to see if there are any narrowings or blockages. In some cases, we may also use a cardiac MRI. While it's less commonly needed, it provides very detailed information about the heart muscle itself and can complement what we learned from an echocardiogram. Each of these tests provide unique and important information. Some look at heart structure, others assess blood flow, and some show us how your heart performs under stress. Together, they help us pinpoint symptoms, identify risk factors, and create a personalized care plan for you. At Virginia Heart, we're proud to offer advanced diagnostic testing and expert interpretation, all with the goal of keeping your heart as healthy as possible.